The alarm screamed through St. Catherine's Medical Center at 2:17 p.m. on a Tuesday afternoon in late October. Dr. Julian Cross stood in the trauma bay, sleeves rolled to his elbows, watching the chaos unfold with barely concealed irritation. 3 gunshot wounds inbound, a construction accident, 2 cardiac arrests already in progress, and his surgical team was down 4 people due to the flu outbreak that had swept through the hospital like wildfire. He needed bodies, qualified bodies. What he got instead was a tattooed grandfather who looked like he'd wandered in from a motorcycle rally. The man appeared in the doorway of the surgical prep area, wearing ill-fitting blue scrubs that hung loose on his frame. Silver gray hair, weathered face, and both arms covered in dark ink that stretched from wrist to shoulder. Military insignias, coordinates, symbols Cross didn't recognize and didn't care to. Cross stopped mid-stride. "Who's that tattooed grandpa?" he said, loud enough for the nearby residents to hear. Dr. Priya Sharma, a second-year resident, glanced up from the chart she was reviewing. Her eyes moved to the older man, then back to Cross. "That's the volunteer the administration sent," she said carefully. "They said we needed extra hands for the evening shift." Cross laughed, actually laughed. "That's their solution? We're running a level 1 trauma center, not a retirement home." The older man didn't react. He stood there, hands at his sides, eyes scanning the room with a calm that seemed out of place in the middle of controlled chaos. He didn't defend himself, didn't speak, just observed. One of the third-year residents, a tall man named Kyle Henderson, smirked from across the room. "Did they pull him from the VA waiting room?" Henderson muttered to another resident. "Look at those tattoos. Probably got them in prison." Sharma said nothing, but her eyes lingered on the older man's hands. They were steady, completely steady. No tremor, no uncertainty. Cross exhaled through his nose and turned to Sharma. "Fine, he can observe. Put him in the corner and keep him out of the way. If he touches a patient, I'm sending him home." Sharma nodded and walked toward the man. "I'm Dr. Sharma," she said quietly. "What's your name?" "Thomas Reeves," he said. His voice was low, gravelly. "They told me you needed help." "We do, but Dr. Cross wants you to observe only for now, just until we see how things go." Thomas nodded once. No argument, no protest. "Understood." Sharma led him to a position near the wall, out of the main flow of traffic. He stood there, hands clasped loosely in front of him, watching everything. The first ambulance arrived 6 minutes later. Paramedics wheeled in a man in his mid-30s, construction worker, impaled through the abdomen by a piece of rebar. Blood soaked through the bandages they'd wrapped around the site. His face was pale, lips tinged blue. "BP 90/60, one of the paramedics shouted. "Heart rate 130. We've got 2 large-bore IVs running wide open." Cross moved in immediately, barking orders. "Get him to Trauma Bay 2. I want to type and cross, 4 units of ONEG on standby, and someone page anesthesia now." The team swarmed the patient. Sharma moved with them, hands already gloved. Ready to assist, Thomas stayed against the wall, watching. Cross worked fast, his hands efficient as he assessed the wound. The rebar had been cut down to 6 inches, but it was still lodged deep in the patient's abdomen, and removing it without vascular control could be fatal. "We need to get him to the OR, Cross said. "Prep him for exploratory laparotomy. This is going to be a long one." Sharma leaned in, checking the monitor. "Doctor, his pressure's dropping." 80/50. Cross frowned, adjusting his gloves. "Increase the fluids. We'll stabilize him upstairs." From the corner, Thomas spoke. "He's bleeding into his retroperitoneum." Every head in the room turned. Cross's eyes narrowed. "Excuse me?" Thomas didn't move from his spot, but his gaze was fixed on the patient. The rebar nicked his inferior vena cava. "You move him now. He'll code before you get him intubated." Cross's jaw tightened. "I didn't ask for your opinion." "You'll lose him in the elevator," Thomas said. His tone wasn't aggressive. It was factual, calm. "You need vascular control here, now." Henderson scoffed. "With what? We're in the ER, not an OR." Thomas's eyes didn't leave the patient. "Aortic compression. Manual if you have to. Proximal control until you can clamp." Sharma's eyes widened slightly. She glanced at the monitor. Pressure still dropping. 75/45. Cross stepped back, face slushed. "I don't know who you think you are, but you're here to observe. That means you don't speak unless spoken to." Thomas said nothing. The patient's monitor beeped faster. Pressure 70/40. Sharma looked at Cross, then at Thomas. "Doctor, what if he's right?" Cross shot her a look that could have melted steel. "He's not." They moved the patient toward the elevator. Cross walked alongside the gurney, one hand on the rail, confident in his decision. They made it 15 feet. The monitor flatlined. "He's in arrest," Sharma shouted. Cross stopped, face going pale. "Get him back to the bay, now." They wheeled the patient back, and the room exploded into motion. Chest compressions. Drugs. Defibrillator charged. Thomas stepped forward. "Let me work." Cross turned, eyes blazing. "Stay back." "He's got less than 2 minutes," Thomas said. His voice was still calm. "You want to save him or prove a point?" For 3 seconds, no one moved. Then Sharma stepped aside. "Let him try." Cross opened his mouth to argue, but the monitor's alarm was screaming, and the patient's lips were turning gray. Thomas moved in. His hands were fast, faster than anyone expected. He didn't ask for instruments. He just took them. Scalpel, retractor, clamp. "Priya, compress the aorta at the diaphragm, now." Sharma didn't hesitate. Her hands moved where he'd should. Thomas's fingers disappeared into the wound, feeling, adjusting. "There," he said. "Vena cava, small tear, suction." Henderson handed him the suction almost on reflex. Thomas worked in silence. No wasted motion. Every move precise. 90 seconds later, the monitor beeped. Once, twice. Steady rhythm. The room went silent. Thomas stepped back, pulling off his gloves. "He's stable. You can take him up now." Cross stared at the monitor, then at Thomas. "Who the hell are you?" Thomas didn't answer. He walked back to his spot against the wall, hands clasped in front of him, and resumed observing. Sharma stared at him, her mind racing. Those hands, that speed, that certainty. She'd seen a lot of surgeons in her career. None of them moved like that. If you want to see how Thomas Reeves handles what comes next, make sure you subscribe to Emergency Heroes Stories, because what just happened? That was only the beginning. Where are you watching from? Drop a comment below. And trust me, what he does in the next few minutes will leave you speechless. The surgery was a success. The construction worker made it through the procedure without complications. Cross performed the repair upstairs. And by the time he returned to the ER 2 hours later, his expression was unreadable. Thomas was still standing in the same spot, observing. Cross walked past him without a word. But the residents noticed. In the break room, 3 of them sat around a small table, coffee cups in hand, voices low but animated. Kyle Henderson leaned back in his chair, arms crossed. "Lucky guess," he said flatly. "That's all it was." Priya Sharma shook her head, stirring her coffee slowly. "That wasn't luck. He knew exactly where the bleed was without imaging. He didn't hesitate." "Come on, Priya," Henderson said. "You really think some random volunteer with prison tattoos is better than Cross?" The guy probably watched a few YouTube videos and got cocky. The third resident, a quiet woman named Lisa Nguyen, spoke up. "Nobody learns to suture like that from videos." Henderson snorted. "Then where he learn it? He's got to be what, 60, 65? Guys older than my dad." Sharma set her cup down. His hands didn't shake, not once. And the way he gave orders, it wasn't a suggestion, it was command. Nguyen nodded slowly. "I noticed that too. He didn't ask for instruments. He just took them, like he'd done it 1,000 times. Henderson rolled his eyes. "So what, you think he's some secret surgeon hiding out as a volunteer? That makes no sense." Sharma didn't answer. She was thinking about the way Thomas had moved. The economy of motion. The absolute certainty. She'd seen senior attendings with less confidence. Across the hospital, in his office, Cross sat at his desk, staring at the incident report he was supposed to file. He should have written up Thomas for overstepping, for performing a procedure without credentials, for undermining his authority in front of the entire trauma team. But the patient was alive, and Cross knew, he hated that he knew, that if Thomas hadn't intervened, the man would have died. He closed the laptop without writing anything. On the floor below, Thomas stood near the nurse's station, hands in his pockets, watching the flow of patients. A nurse approached him, an older woman named Diane, who'd been at St. Catherine's for 30 years. "You did good work today," she said quietly. Thomas nodded, but didn't smile. "Just trying to help." Diane studied him for a moment. "I've been doing this a long time. I know the difference between someone who's helped and someone who's done it under fire." Thomas met her eyes briefly, then looked away. "It was a long time ago." Diane didn't press. She just nodded and walked back to her station. By evening, word had spread. The story of the tattooed volunteer who'd saved a crashing patient had made its way through the ER, growing slightly with each retelling. Some said he'd performed open-heart surgery with a pocket knife. Others said he'd brought someone back from the dead. Most of it was exaggeration, but not all of it. At 6:47 p.m., Cross found Thomas in the hallway outside the trauma bay. "Reeves," Cross said, his tone clipped. "A word." Thomas turned, his expression neutral. "Yes, doctor." Cross stepped closer, lowering his voice. "I don't know what you think you proved today, but let me be very clear. You are here as a volunteer. That means you observe. You assist when asked. You do not take over my trauma bay." Thomas said nothing. Cross continued. "I don't care where you trained or what you think you know. This is my department. My hospital. And if you ever pull something like that again, I'll have security escort you out. Are we clear?" Thomas held his gaze for a long moment. "Clear," he said quietly. Cross nodded curtly and walked away. Thomas stood there for a moment, hands at his sides, then returned to his post. Sharma watched the exchange from the nurse's station. She didn't hear what was said, but she saw the way Cross's shoulders were tight, his jaw clenched. She also saw the way Thomas didn't flinch, didn't argue, didn't defend himself, just accepted it and moved on. That night, Sharma went home and couldn't stop thinking about it. She pulled out her laptop and started searching. Thomas Reeves, volunteer, surgeon, nothing. She tried different combinations: military surgeon, combat medic, trauma specialist. Still nothing that matched. But then she noticed something. The tattoos. She'd seen one of them clearly when he'd rolled up his sleeves. A set of coordinates on his left forearm. She typed them into Google Maps. Mogadishu, Somalia. Her breath caught. Somalia. Black Hawk Down. The battle in '93 that every military history student knew about. She kept searching, diving deeper into military medical records, declassified reports, anything she could find. And then she found a reference. A single line in an after-action report from Operation Gothic Serpent. Unidentified medical personnel performed life-saving surgeries under fire. Estimated 40+ casualties treated. Identity unconfirmed. Sharma sat back in her chair, staring at the screen. 40+ casualties. Under fire. Unidentified. She looked at the date of the report. October 1993. 31 years ago. Which would make Thomas around 62 now. The age fit. She clicked on another link. A forum for military veterans. Someone had posted about the ghost of Mogadishu, a legend among certain units. A surgeon who'd appeared during the worst of the fighting, saved dozens of lives, then vanished. No name, no records, just stories. Sharma closed her laptop slowly. She didn't know if it was him, but the pieces were starting to fit. The next morning, Thomas arrived at the hospital at 6 a.m., just as he had the day before. He checked in at the volunteer desk, received his assignment, and made his way to the ER. Cross was already there, reviewing charts with the night shift attending. He saw Thomas enter and his jaw tightened, but he said nothing. Thomas took his position near the wall and waited. At 7:15 a.m., the first call came in. Multi-vehicle collision on the interstate. 4 ambulances inbound. ETAs ranging from 8 to 15 minutes. The ER mobilized immediately. Trauma base prepped. Surgical teams notified. Blood bank on standby. Cross stood in the center of the chaos, directing traffic, his voice sharp and clear. "Sharma, you take Bay 1. Henderson, Bay 2. When you're with me in Bay 3. He paused, then looked at Thomas. "Reeves, you take Bay 4. Least critical patient. And you do not deviate from protocol. Understood?" Thomas nodded. "Understood." Sharma glanced at Cross, surprised. Giving Thomas his own patient was a risk. Either Cross was testing him, or he was setting him up to fail. Maybe both. The ambulances arrived in rapid succession. Bay 1, 18-year-old male, blunt chest trauma, possible pneumothorax. Bay 2, middle-aged woman, multiple fractures, stable but in severe pain. Bay 3, elderly man, head injury, decreased level of consciousness. Bay 4, 26-year-old female, minor lacerations, complaining of abdominal pain. Thomas moved to Bay 4. The woman was conscious, alert, talking to the paramedics. Vitals stable. Pressure normal. Heart rate slightly elevated, but nothing alarming. The paramedic gave report. Rear-ended at low speed. Airbag deployed. She's got some cuts from the glass, but she walked away from the scene, mostly shaken up. Thomas approached the bed, his eyes scanning her face, her posture, the way she held her abdomen. "Where does it hurt?" he asked quietly. "Right here," she said, pointing to her lower right side. "It's not terrible. Just sore." Thomas nodded. He placed his hand gently on her abdomen, pressing lightly in different areas. When he reached the right lower quadrant, she winced. "That hurt?" he asked. "A little, like a bruise." Thomas's eyes narrowed slightly. He checked her vitals again on the monitor. Pressure still normal. But her heart rate had ticked up another 5 beats. He leaned closer, listening to her breathing. Then he smelled it. Faint, barely there, but unmistakable. The metallic tang of internal bleeding. Thomas straightened, his expression unchanged, but his hands moved faster. "I need an ultrasound," he said to the nurse standing nearby. "Now." The nurse hesitated, glancing toward the other bays where doctors were managing more obviously critical patients. "She's stable," the nurse said. "Dr. Cross said." "Now," Thomas repeated. His voice was calm, but there was steel underneath. The nurse hurried off. The young woman on the bed looked up at him, confused. "I'm okay, right? It's just bruising?" Thomas met her eyes. "I need to check something. Stay still for me." The portable ultrasound machine arrived 90 seconds later. Thomas took the probe, apply gel to her abdomen, and began scanning. He moved methodically. Right upper quadrant, left upper quadrant, then down to the pelvis. He stopped. On the screen, a dark pocket of fluid pooled near her spleen. Free fluid, blood. Her spleen was bleeding. Slowly, but bleeding. Thomas set the probe down and turned to the nurse. "Page Dr. Cross. Tell him we need an OR immediately. Splenic laceration with active hemorrhage." The nurse's eyes went wide. "But her vitals are stable now. In 10 minutes, they won't be. Page him." The nurse ran. Thomas turned back to the patient, his voice gentle. "You're going to be okay, but we need to get you to surgery. Your spleen is injured. Do you understand?" The woman's face went pale. I feel fine. "I know, but your body's compensating. We need to fix this before it can't anymore." 2 minutes later, Cross arrived, his face tight with irritation. "What's going on?" Thomas gestured to the ultrasound screen. "Splenic lac. Free fluid in Morrison's pouch and the pelvis. She's bleeding." Cross looked at the monitor displaying her vitals. "Pressure's normal. Heart rate's only slightly elevated. She's young and healthy," Thomas said. "She'll stay stable until she doesn't, and when she crashes, it'll be fast." Cross stared at the screen, then at Thomas. For a moment, neither man spoke. Then Cross turned to the nurse. "Prep OR2. Type and cross for 4 units. Let's move." They wheeled the patient out. She was asking questions, scared now, but still conscious. Sharma appeared at Thomas's side, having stabilized her own patient. "How did you know?" she asked quietly. Thomas pulled off his gloves. Mechanism of injury. Seatbelt across the abdomen. Airbag deployed. Blunt force to the spleen. And she smelled like blood. Sharma blinked. "Smelled?" Thomas nodded. "Internal bleeding has a scent. Faint. Most people don't notice it. But if you've been around enough trauma, you learn." Sharma stared at him. "Where did you train?" Thomas didn't answer. He just walked back toward his observation post. Sharma watched him go, her mind spinning. The surgery took 2 hours. Cross returned to the ER afterward, his face unreadable. He found Thomas standing near the nurse's station. "She's stable," Cross said quietly. "We removed the spleen. She'll recover fully." Thomas nodded. Cross hesitated, then added, "You were right." Thomas met his eyes, but said nothing. Cross walked away. Henderson, who'd been standing nearby, shook his head. "Okay, that's twice now," he muttered to Nguyen. "Maybe it's not luck." Nguyen crossed her arms. "You think?" By midday, the ER had settled into a relative calm. The multi-vehicle collision patients were either in surgery, admitted, or discharged. The usual flow of chest pain, minor injuries, and abdominal complaints filled the bays. Thomas remained at his post, hands clasped, watching. Sharma approached him during a lull, 2 cups of coffee in hand. She offered him one. "Thank you," Thomas said, taking it. They stood in silence for a moment. "You don't talk much," Sharma said. "Not much to say." "You saved 2 people in 2 days. I think that's worth talking about." Thomas sipped his coffee. "I just do what needs doing." Sharma studied his face, the lines around his eyes, the way his gaze never stopped moving, always assessing, always watching. "You were military," she said. It wasn't a question. Thomas didn't confirm or deny. "A long time ago." "How long?" "Long enough that it doesn't matter anymore." Sharma wanted to press, but something in his tone stopped her. Instead, she asked, "Why volunteer here? You could be teaching, consulting. You've obviously got the skills." Thomas's jaw tightened slightly. "Teaching's not for me." "Why not?" He looked at her then, and for just a second, she saw something in his eyes. Something old and tired. "Because I'm better at doing than talking." Before Sharma could respond, the ER doors burst open. A man stumbled in, clutching his chest, his face gray. "Help," he gasped. "Can't breathe." He collapsed. Thomas moved instantly. He crossed the 20 feet to the man in seconds, dropping to his knees beside him. "Get a gurney," he called, "and a crash cart." Sharma was already moving, shouting orders. Thomas checked for a pulse. Faint. Irregular. He ripped open the man's shirt. No obvious trauma. But his jugular veins were distended, bulging against his neck. His trachea was shifted slightly to the right. Thomas's eyes narrowed. "Tension pneumothorax," he said. Henderson arrived with the crash cart. "How do you know? We haven't even—" "Distended neck veins, tracheal deviation, hypotension. It's a tension pneumo. We decompress now or he dies." Sharma handed him a large bore needle without hesitation. Thomas positioned it over the man's second intercostal space, mid-clavicular line. He pushed it in. There was a hiss of air. Immediate release of pressure. The man gasped, his color improving almost instantly. Thomas pulled the needle, and Sharma was already preparing a chest tube. They worked together in silence. No wasted words, no hesitation. Within 4 minutes, the chest tube was in place. The man was breathing easier, and his vitals were stabilizing. Cross appeared. Having heard the commotion, he looked at the patient, then at Thomas. "Needle decompression?" "Yes," Thomas said simply. Cross glanced at the monitor. Oxygen saturation climbing. Pressure normalizing. "Good call," Cross said quietly. Thomas stood, pulling off his gloves. "He'll need imaging to confirm, but he should be stable now." Cross nodded. As Thomas walked away, Henderson turned to Sharma. "Okay, seriously, who is this guy?" Sharma shook her head slowly. "I don't know. I'm going to find out." That evening, after her shift ended, Sharma stayed late in the hospital library, searching through medical journals, military records, anything she could access. She kept coming back to those coordinates tattooed on Thomas's arm. Mogadishu. She found more references to the ghost of Mogadishu, a surgeon who'd operated in a bombed-out building for 18 hours straight, who'd saved soldiers, locals, even enemy combatants, who'd vanished after the battle ended. No official records, no name. Just stories passed among veterans. Some said he'd died. Others said he'd simply disappeared. Sharma sat back, staring at the screen. If Thomas was the ghost, why was he here, volunteering in a civilian ER, letting people like Cross treat him like he didn't matter? What was he hiding from, or running from? She didn't have answers, but she was certain of one thing. Thomas Reeves was not just some random volunteer. He was someone with a past. And that past was starting to surface. 3 days passed. Thomas continued his quiet routine. Arrive at 6 a.m., observe, assist when needed, leave at 6 p.m. without fanfare. Cross stopped challenging him openly, though attention remained. The residents had stopped making jokes about his tattoos. Even Henderson watched him now with something closer to respect than mockery. But no one knew who he really was, until the helicopter fell from the sky. It happened at 2:38 p.m. on a Friday afternoon. The call came through dispatch first, then over the hospital's emergency frequency. All available trauma staff to the ER. Mass casualty incident. Military helicopter crash during training exercise. Multiple critical injuries inbound. ETA 12 minutes. The words cut through the hospital like a blade. Cross's voice boomed across the department. Everyone, listen up. We're going to Moscow protocol. Clear all non-critical patients. I want every trauma bay open. Blood bank, get us 20 units of O-neg ready. Anesthesia, I need 2 teams standing by. Move. The ER transformed in seconds. Organized chaos. Nurses running, residents prepping bays, equipment rolling into position. Thomas stood near the wall, his face unreadable, but his hands had curled into fists. Sharma noticed. She moved beside him. You okay? Thomas didn't look at her. I'm fine. But his voice was tighter than usual. The first ambulance arrived 11 minutes later. Paramedics threw open the doors and rushed in a gurney, carrying a man in full military fatigues, his uniform soaked in blood. Sergeant First Class David Chen, 34 years old, the paramedic shouted. Blunt chest trauma, possible flail chest, BP 90/60, heart rate 140. He's been in and out of consciousness. Cross directed them to Bay 1. The second ambulance arrived 30 seconds later. Another soldier, younger, compound fracture of the femur, screaming in pain. Bay 2. The third ambulance came in hot, sirens wailing until the very last second. 2 paramedics flanked a gurney carrying a man in his late 50s, silver hair matted with blood, his chest barely rising. Lieutenant General Marcus Bradley, the lead paramedic said, his voice strained. Massive blunt force trauma, suspected aortic injury. Tension pneumothorax decompressed in the field. BP 60/40 and dropping. He's circling the drain. Cross's face went pale. A 3-star general. He turned to his team. Get him to Bay 3. Someone page the chief of surgery, now. They wheeled the general in. His eyes were half closed, his breathing shallow and labored. Blood seeped through the bandages wrapped around his torso. Cross moved to the head of the bed, assessing rapidly. Sharma was at his side, already calling out orders. 2 large-bore IVs, Cush fluids wide open. Get me a chest X-ray portable. Thomas stood 20 feet away, watching. His eyes were locked on the general's face. Sergeant Chen, the first soldier, had been moved to a bed near the wall. His breathing was ragged, painful. A nurse was trying to get a line in, but his veins were collapsing. Chen turned his head slightly, his eyes unfocused. Then he saw Thomas. His gaze sharpened. He stared at the tattoos on Thomas's arms. The coordinates, the unit insignias, the faded symbols. His lips moved. Wait. The nurse didn't hear him, but Thomas did. Chen's voice was a rasp. Those coordinates, Mogadishu. Thomas's jaw tightened. Chen tried to sit up, wincing in pain. I know those marks. I've seen them before, in photos, stories. His voice trailed off, his eyes widening. You're the ghost. The nurse finally noticed Chen's agitation. Sir, you need to stay still. But Chen wasn't looking at her. He was staring at Thomas. You trained medics in Mogadishu, Fallujah, Kandahar. You're Doc Reeves, the ghost of Mogadishu. Thomas didn't move, didn't confirm, didn't deny. He just stood there, silent. Across the room in Bay 3, the general's condition was deteriorating. Cross had his hands on the man's chest, feeling for rib fractures, checking breath sounds. Decreased breath sounds on the left, he said. Possible hemothorax. We need to get a chest tube in. Sharma prepped the equipment, but the monitor was screaming. Pressure's dropping, she said. 50/30. Cross's face was tight. He's bleeding out internally. We need to get him to the OR now. He won't make it, Sharma said quietly. Cross looked at her sharply. What? He won't survive the move, not like this. He needs damage control here. Cross shook his head. We can't do a thoracotomy in the ER. We don't have the setup. Then he dies, Sharma said. Cross stared at the monitor, at the general's gray face, at the blood pooling beneath the gurney. He exhaled slowly. Triage him black. There's nothing more we can do. Sharma's hands froze. Doctor! That's an order, Sharma. We focus on the ones we can save. From across the room, Thomas spoke. Give me 15 minutes. Every head turned. Cross's eyes narrowed. What did you say? Thomas walked forward, his stride steady, his voice calm. Give me 15 minutes. I can stabilize him. Cross stepped between Thomas and the gurney. You're not touching him. You're not credentialed. You're not authorized. And this is a 3-star general. I'm not letting some volunteer. He's got a torn aorta and a hemothorax, Thomas said, cutting him off. You move him, he's dead. You wait, he's dead. I can give you a third option. Cross's jaw clenched. You're out of your mind. Thomas met his eyes. Probably, but I'm also right. Sergeant Chen's voice cut through the room, weak but insistent. Let him work. Cross turned, confused. What? Chen was propped up slightly now, his breathing still labored, but his eyes clear. That man saved my life in Fallujah. Saved 47 soldiers in Mogadishu. Operated under fire for 18 hours straight. If anyone can save the general, it's him. Cross stared at Chen, then at Thomas. Who the hell are you? Thomas didn't answer. He just looked at the general, whose monitor was starting to flatline. Sharma made the decision. She stepped aside. Do it. Cross turned on her. Sharma, if you let him. Then fire me, she said. But I'm not watching another person die when we have a chance. Thomas moved to the bedside. His hands were already gloved. I need a 10-blade, rib spreaders, clamps, and someone who can follow orders without questioning them. Sharma positioned herself across from him. I'm with you. Thomas looked at her, just for a second, and nodded. Then he looked down at the general's face. The man's eyes fluttered open, just barely. He saw Thomas. Recognition flickered. His lips moved, forming a single word. Doc. Thomas's expression didn't change, but his hands steadied. I've got you, General, just like last time. The general's eyes closed. Thomas picked up the scalpel. Let's get to work. Cross stood frozen, his face pale, as Thomas made the first incision. And the room held its breath. Thomas's blade moved in one clean line across the general's left chest. Blood welled immediately, but his hands didn't hesitate. Rib spreaders, he said. Sharma handed them over, her movements precise despite the chaos. Thomas positioned the spreaders between the ribs and began cranking them open. The sound of metal on bone filled the room, visceral and haunting. Cross took a step forward, his voice tight. You're performing an emergency thoracotomy in my ER without authorization. I should stop you right now. Thomas didn't look up, then stop me. Cross didn't move. Thomas's hands disappeared into the chest cavity, feeling, assessing. Massive hemothorax. At least 2 liters of blood in the pleural space. Suction. Sharma activated the suction. Dark red blood poured out, filling the canister rapidly. Henderson stood nearby, frozen, his face pale. Jesus, he whispered. Thomas's fingers traced the aorta, moving carefully along its length. There, he said quietly. Partial transection, descending aorta. He's bleeding directly into the chest. Sharma's eyes widened. Can you repair it here? I'm going to clamp it first, then we'll see. His hands moved with absolute certainty. No tremor, no hesitation. He placed a vascular clamp across the aorta, proximal to the tear. The bleeding slowed immediately. Pressure? Thomas asked. Sharma checked the monitor. Rising. 70/45. Good. He's got a chance now. Get me a 4-0 Proline suture. A nurse handed it over. Thomas began suturing the tear in the aorta. His stitches small, tight, perfectly spaced. Every movement was economical. Every motion had purpose. Cross watched, his expression shifting from anger to disbelief. This is impossible, he muttered. No one does this kind of repair in an ER. Sergeant Chen, still conscious in the nearby bed, spoke hoarsely. He did it in a bombed-out school in Mogadishu. No lights, no anesthesia, just him and a headlamp. Cross turned to Chen. What are you talking about? Chen coughed, wincing. That's Doc Reeves. He's a legend. Saved my life in Fallujah when I took shrapnel to the chest. I was dead. Everyone said so, but he brought me back. Cross's eyes moved back to Thomas. Who are you? He asked again, quieter this time. Thomas didn't answer. His focus remained on the aorta, his sutures continuing in perfect rhythm. Sharma leaned in closer, watching his technique. Those sutures, she said, that's a running width stitch. I've only seen that in military surgical manuals. Thomas tied off the last suture. Because it's faster, and faster keeps people alive. He removed the clamp slowly, watching for leaks. The suture line held, no bleeding. Sharma exhaled, a sound of pure relief. It's holding. Thomas nodded. Now the lung. He inspected the lung tissue, finding a laceration along the lower lobe. Minor tear. We can oversew it. He worked quickly, closing the lung injury with interrupted sutures. The entire procedure took 11 minutes. When he finished, he stepped back, pulling off his gloves. He needs to go to the OR for a formal washout and closure, but he'll make it. The monitor showed stable vitals. Pressure 90/60. Heart rate 110. Elevated but steady. The room was silent. Cross stared at the general, then at Thomas. How did you do that? Thomas didn't answer immediately. He walked over to a sink and began washing his hands, his back to the room. Sharma spoke for him. Dr. Cross, I think you need to hear this. She pulled out her phone and showed him something she'd found the night before. A declassified military report from 1993. Cross read it, his face going pale. Operation Gothic Serpent, Mogadishu. Unidentified surgeon performed emergency surgeries under fire. Saved an estimated 47 lives. Cross looked up. This is you? Thomas dried his hands slowly. It was a long time ago. Chen spoke again, his voice stronger now. It's him. I've seen the photos, the stories. He's the ghost. Henderson, who'd been silent, finally found his voice. The ghost of Mogadishu? That's a myth, a legend soldiers tell. Chen shook his head. He's real, and he's standing right there. Cross set the phone down, his hands shaking slightly. Why didn't you say anything? Why didn't you tell us? Thomas turned, his expression unreadable. Because it doesn't matter who I was. Only what needs to be done. Cross opened his mouth, then closed it. For once, he had no response. Sharma stepped forward. Dr. Cross, we need to move the general to the OR now. Cross nodded, his movements mechanical. Yes, right. Henderson, prep OR 1. Full surgical team. Move. They began wheeling the general out. His eyes fluttered open again, just briefly. He looked at Thomas. Doc, you're alive. Thomas moved closer, his voice quiet. So are you, General. Just like Mogadishu. The general's lips twitched into the faintest smile before his eyes closed again. They wheeled him away. The ER was still. Sharma stood beside Thomas, her mind racing. Mogadishu, she said quietly. Black Hawk down. You were there. Thomas nodded once. I was there. How many did you really save? Thomas's jaw tightened. 47 soldiers. 12 civilians. 3 Somali fighters who would have died otherwise. Sharma's breath caught. And after? Thomas looked away. I kept going. Iraq, Afghanistan, 6 tours. Over 800 surgeries. Why didn't you stay in the military? Thomas was silent for a long moment. Kandahar, 2011. IED hit our field hospital. Killed my entire surgical team. 7 people. I was the only one who walked out. Sharma's eyes filled with understanding. You blame yourself. Thomas didn't respond, but his silence was answer enough. Cross approached, his earlier arrogance completely gone. I owe you an apology, he said quietly. I made assumptions. I was wrong. Thomas met his eyes. You did what you thought was right. That's all any of us can do. Cross extended his hand. Thomas shook it. I'd like to offer you a position, Cross said. Permanent. Senior trauma surgeon. Full privileges. Thomas hesitated. I'm retired. You just saved a 3-star general's life in an ER, with no proper equipment. You're not retired. You're just waiting. Thomas looked at Sharma, then back at Cross. I'll think about it. Cross nodded. That's all I ask. He walked away, leaving Thomas and Sharma alone. You should take it, Sharma said. Thomas shook his head slowly. I left that lice behind for a reason. What reason? Thomas looked at his hands, at the faint scars on his knuckles, at the tattoos that covered his forearms. Because I was tired of losing people. Sharma's voice was gentle. You didn't lose anyone today. Thomas didn't respond, but something in his expression shifted. Just slightly. Across the hospital in 081, the general was stable. The surgical team completed the washout and formal closure without complications. By evening, he was in recovery, awake and alert. The first thing he asked for was Thomas. They brought him to the recovery room. The general looked up, his face still pale, but his eyes clear. Doc Reeves, he said, his voice rough. I thought you were dead. Thomas stood at the foot of the bed. I thought the same about you a few times, General. Bradley smiled weakly. Mogadishu. You pulled me out of that building. Operated on me with a flashlight and a prayer. You made it easy. You're stubborn. Bradley laughed. Ed then winced. Still am. He paused. Why'd you disappear? Thomas's expression darkened. I had my reasons. Bradley studied him. Kandahar? Thomas nodded. I heard about that, Bradley said quietly. I'm sorry. Thomas said nothing. Bradley shifted slightly in the bed. You saved my life twice now, Doc. I owe you. You don't owe me anything. I do. And I'm going to make sure people know who you are, what you've done. Thomas's jaw tightened. General, no arguments, Doc. You've been hiding long enough. Thomas looked at him for a long moment, then nodded slowly. Get some rest, General. He turned to leave. Bradley's voice stopped him. Doc, thank you. Thomas paused at the door, then left without another word. The news spread before morning. By 6 a.m., the hospital administration knew. By 7, the local news had picked up the story. By noon, it was national. Legendary military surgeon saves general's life in civilian ER. Thomas arrived at the hospital at his usual time, 6 a.m., expecting another quiet shift. Instead, he found a crowd. Reporters outside the entrance. Cameras. Microphones thrust toward anyone in scrubs. He turned and used the staff entrance instead. Inside, the ER felt different. Nurses who barely acknowledged him before nodded respectfully as he passed. Residents stopped talking when he entered a room, their eyes following him. Thomas hated it. He found his usual spot near the wall and stood there, hands clasped, trying to disappear into the background. It didn't work. Cross found him within 10 minutes. Reeves, my office. Now. Thomas followed him down the hallway to a small office overlooking the ambulance bay. Cross closed the door behind them. Sit, Cross said. Thomas remained standing. Cross sighed and sat down himself, rubbing his temples. The hospital board wants to meet you. The press wants interviews. The Department of Defense called an hour ago, asking if you'd consult on a new trauma training program. Thomas said nothing. Cross looked up at him. You're a legend, Reeves, whether you like it or not. I didn't ask for this. I know, but it's happening anyway. Cross leaned forward. The board wants to offer you chief of trauma surgery. Full position, whatever salary you want, complete autonomy. Thomas shook his head. I'm not interested. Why not? Thomas looked out the window at the ambulances below. Because I came here to help quietly, not to be in charge. Cross studied him for a long moment. You're afraid. Thomas's jaw tightened, but he didn't respond. You're afraid that if you take responsibility again, you'll lose people, like Kandahar. Thomas turned sharply. You don't know anything about Kandahar. Then tell me. Thomas was silent. Cross softened his tone. Look, I was an arrogant ass when you arrived. I judged you based on appearance, age, and my own ego. I was wrong. But running from your past won't change it. Thomas's hands curled into fists. Those 7 people died because I made a call. I chose to set up the field hospital in that location. I prioritized speed over security, and they paid for it. You were in a war zone, Cross said quietly. You did what you thought was right, and I was wrong. Cross leaned back in his chair. How many people did you save before that? 800 surgeries, right? How many lived because of you? Thomas didn't answer. How many? Cross pressed. I don't know. I stopped counting. But it's more than 7. Thomas's voice was barely a whisper. It doesn't balance out. Cross stood and walked around the desk. You're right. It doesn't. 7 people died, and nothing will change that. But hundreds lived. And yesterday, a 3-star general lived because he refused to give up. That matters. Thomas looked away. Cross continued. I'm not asking you to forget Kandahar. I'm asking you to stop letting it define you. Before Thomas could respond, there was a knock on the door. Sharma entered, her face urgent. Dr. Cross, we have a situation. Cross turned. What is it? Sergeant Chen is asking for Thomas. Says it's important. Thomas followed Sharma back to the recovery ward. Chen was sitting up in bed, his chest bandaged, but his color much better. When he saw Thomas, he gestured him closer. Doc, I need to tell you something. Thomas approached the bed. What is it, Sergeant? Chen's voice was low. Kandahar. 2011. The IED that hit your field hospital. Thomas went still. How do you know about that? Because I was part of the investigation afterward. Chen paused. Doc, you need to know something. That attack wasn't random. Thomas's face hardened. What are you saying? The Taliban knew where your hospital was. They'd been planning the attack for weeks. But the reason they knew, Chen hesitated. There was a leak. Someone in command gave up your location. Thomas stared at him. That's not possible. It is. I saw the classified report. A lieutenant colonel was feeding intelligence to the enemy. He was arrested 6 months later, but by then, the damage was done. Thomas's hands trembled. You're telling me my team died because of a traitor? Chen nodded. You didn't fail them, Doc. You were set up. Thomas turned away, his breathing uneven. For 3 years, he'd carried the weight of those deaths. Believed it was his fault, his decision, his failure. And now, in a single moment, that weight shifted. Sharma, who'd been standing nearby, spoke softly. Thomas, you didn't kill them. Thomas's voice was raw. I should have seen it, should have known. You couldn't have, Chen said. None of us did. But I wanted you to know the truth. You deserve that much. Thomas stood there, silent, his mind reeling. After a long moment, he looked at Chen. Thank you, Sergeant. Chen nodded. Thomas left the room, moving through the hospital corridors in a daze. He ended up in the chapel, a small quiet room on the 3rd floor that most people didn't know existed. He sat in the back row, staring at nothing. Sharma found him there 20 minutes later. She sat beside him, saying nothing at first. Finally, she spoke. I can't imagine what you're feeling right now. Thomas's voice was hollow. I spent 3 years hating myself, believing I killed them. And now I don't know what to feel. Sharma turned to face him. Feel relief. Feel anger at the person who betrayed you. But don't feel guilt. Not anymore. Thomas looked at her. It's not that simple. I know. But it's a start. They sat in silence for a while. Then Thomas spoke again. Cross offered me chief of trauma surgery. I know. I was there when the board discussed it. I told him no. Sharma nodded slowly. Can I ask why? Thomas exhaled. Because I'm afraid. Afraid that if I take that responsibility, I'll lose people again. And I don't think I can survive that. Sharma's voice was gentle, but firm. You won't be alone this time. You'll have a team. Residents who want to learn from you. Surgeons who respect you. And you'll be teaching us how to save lives, not just saving them yourself. Thomas looked at her. You think I should take it? I think you're the best trauma surgeon I've ever seen. And I think hiding that helps no one. Thomas was quiet for a long time. Then he stood. I need to think. Sharma stood as well. Take all the time you need. But Thomas, don't let fear make your decisions. You're better than that. He nodded and left the chapel. 2 hours later, Thomas found Cross in his office. Cross looked up, surprised. Reeves. Thomas stood in the doorway, his posture straighter than before. I'll take the position. Cross's eyes widened. You will? On 3 conditions. Cross gestured for him to continue. 1. I want to establish a combat trauma training program for civilian surgeons. Teach them the techniques that save lives in the field. Cross nodded. Done. 2. I choose my own team. Residents, attendings, everyone. Agreed. 3. No press. No interviews. I do the work. That's it. Cross hesitated, then nodded. I'll handle the media. You focus on surgery. Thomas extended his hand. Cross shook it, a genuine smile crossing his face. Welcome to St. Catherine's. Dr. Reeves, officially this time. Thomas allowed himself the smallest hint of a smile. Thank you. As he left the office, Sharma was waiting in the hallway. You said yes, she said. Thomas nodded. I did. What changed your mind? Thomas looked at her, his expression softer than she'd ever seen. Someone reminded me that hiding doesn't honor the people I lost. Teaching does. Sharma smiled. I'm glad. Thomas looked down the hallway toward the ER, where the sounds of beeping monitors and urgent voices echoed. So am I. For the first time in 3 years, the weight on his shoulders felt lighter. Not gone, but lighter. And that was enough. 2 weeks later, Thomas stood in front of a conference room, filled with surgical residents, attendings, and nursing staff. His first official meeting as chief of trauma surgery. He'd spent the previous 14 days reviewing protocols, meeting with department heads, and designing the framework for his combat trauma training program. The hospital administration had given him everything he'd asked for: funding, equipment, and complete autonomy. Now came the hard part: teaching. Cross sat in the front row, arms crossed, watching with interest. Sharma sat beside him, a notebook open on her lap. Henderson and Gwen were in the back, along with a dozen other residents. Thomas cleared his throat. I'm not good at speeches, he began. So I'll keep this short. He clicked a remote, and an image appeared on the screen behind him. A field hospital in Afghanistan. Tents, dust, blood on the ground. This is where I learned trauma surgery. Not in a classroom, not in a controlled OR, but here, under fire, with limited supplies and no time for second guessing. He clicked again, another image. A young soldier on a stretcher, his chest open, Thomas's hands inside. This is Private James Kirkland, 22 years old. IED took off his left leg and punctured his heart. Everyone said he was gone. But I had 3 minutes and a chest tube, so I worked. He paused. He lived, married now, 2 kids. The room was silent. Thomas clicked to the next slide, a list of procedures. I'm here to teach you how to do what I did. Not just the techniques, but the mindset. Trauma surgery isn't about perfection. It's about speed, adaptability, and refusing to quit when everything says you should. He looked around the room. Some of you will think this is Ooh, aggressive, too risky. And you're right, it is. But the alternative is watching people die who didn't have to. Cross leaned forward slightly. Thomas continued. We're starting a 6-month intensive program. Every resident in this room will rotate through. You'll learn damage control surgery, field triage, and how to operate with minimal resources. You'll also learn when to stop, when to say enough. He clicked to the final slide, a photo of his fallen team in Kandahar. These are the people I lost. 7 surgeons, nurses, and medics, the best team I ever worked with. They died because I couldn't protect them. His voice was steady, but the emotion underneath was unmistakable. I can't bring them back, but I can make sure their knowledge doesn't die with them. That's what this program is, their legacy. He turned off the screen. Questions? Sharma raised her hand. When do we start? Thomas allowed himself a small smile. Tomorrow, 0600. Simulation lab. Wear clothes you don't mind ruining. Henderson spoke up from the back. What if we fail? Thomas met his eyes. You will fail. Multiple times. That's the point. Better to fail here than in a real OR when someone's life is on the line. Henderson nodded slowly. The meeting ended shortly after. Residents filed out, some excited, others apprehensive. Cross approached Thomas. That was good, he said. Honest. Thomas nodded. They needed to know what they're getting into. Cross hesitated, then said, I'm sorry I didn't see it before. Who you were, what you've been through. Thomas looked at him. You saw a tattooed old man. Most people would have done the same. Still, I should have known better. Thomas extended his hand. We're good, Julian. Cross shook it, surprised by the use of his first name. We're good. Over the next 2 months, the program took shape. Thomas ran the residents through scenario after scenario. Simulated mass casualties. Patients crashing mid-surgery. Equipment failures. Every possible disaster he could think of. And he was relentless. When Henderson hesitated during a simulated chest tube insertion, Thomas stopped him. Hesitation kills. If you're not sure, ask. But once you commit fully. Again. Henderson repeated the procedure. Faster this time. Better, Thomas said. When Nguyen struggled with a vascular repair, Thomas guided her hands. Feel the vessel wall. It'll tell you where to place the suture. Let your fingers think, not your eyes. Nguyen closed her eyes, her hands moving by touch alone. The suture held. Excellent, Thomas said quietly. Sharma excelled. She absorbed everything Thomas taught, asked questions, and pushed herself harder than anyone else. One evening, after a particularly brutal simulation, she found Thomas in his office, reviewing footage of the day's exercises. You're staying late, she said. Thomas looked up. Habit. Sharma sat down across from him. Can I ask you something? Go ahead. Why did you really come back? It wasn't just about helping. You could have stayed retired. Thomas leaned back in his chair. After Kandahar, I tried to disappear. Moved to a small town. Worked at a VA clinic. Kept my head down. But every time I saw someone die who shouldn't have, I felt like I was failing all over again. So I started volunteering. Thought maybe I could do some good without the responsibility. And then the helicopter crash happened. Thomas nodded. I realized I couldn't keep running. The work was always going to find me. Sharma smiled. I'm glad it did. Thomas looked at her. So am I. 3 months into the program, the hospital's trauma outcomes had improved. by 23%. Surgeries were faster. Complications were down. Residents were more confident. The board noticed. So did the Department of Defense. General Bradley, now fully recovered, visited the hospital in early January. He walked through the trauma unit with Thomas, observing a simulation in progress. "You've built something impressive here, Doc," Bradley said. Thomas watched Sharma lead a team through a multi-casualty scenario. "They did the work. I just showed them how." Bradley smiled. "The DoD wants to adopt your protocols. Implement them nationwide in military and civilian trauma centers." Thomas turned to him. "Nationwide? Your techniques save lives, Doc. They want to make sure every surgeon has access to them." Thomas was quiet for a moment. "What would that involve?" "Training manuals, video demonstrations, maybe some travel to teach senior surgeons. But you'd have full control over the curriculum." Thomas looked back at the simulation. "I'll think about it." Bradley nodded. "That's all I ask." That evening, Thomas stood in the chapel again. It had become a routine, a place to think. He thought about the past 3 months, the residents he'd trained, the lives saved, the weight that had slowly lifted from his shoulders. He thought about his fallen team, their faces, their voices, and for the first time, he didn't feel guilt. He felt gratitude. Gratitude that he'd known them, learned from them, and now, through this program, was passing on what they'd taught him. Sharma found him there, as she often did. "You're going to say yes to the DoD, aren't you?" Thomas smiled slightly. "How'd you know?" "Because you can't help yourself. You see a way to save more lives and you take it." Thomas nodded. "I'm going to need help. Someone to co-develop the curriculum. Someone who knows how to teach." Sharma's eyes widened. "You want me to help?" "I do. If you're interested." Sharma didn't hesitate. "I'm in." Thomas extended his hand. She shook it, grinning. "This is going to be incredible," she said. Thomas looked toward the windows, where the lights of the city stretched out into the distance. "Yeah," he said quietly. "It is." 2 weeks later, a hospital held a formal ceremony recognizing Thomas's contributions. He hated every second of it. But he stood on the stage, accepted the plaque, and gave a brief speech thanking his team. When it was over, he retreated to his office, relieved to be away from the crowd. Cross found him there. "You did good today." Thomas grunted. "I did what was required." Cross laughed. "You'll never enjoy the spotlight, will you?" "No." "Good. Keeps you honest." Cross left, and Thomas sat alone in his office. On his desk was a photo he'd brought from home. His team in Kandahar, smiling, alive. He looked at their faces. "I hope I made you proud," he said quietly. The photo, of course, didn't answer, but somehow, Thomas felt like it did. 6 months after Thomas accepted the position, St. Catherine's trauma program had become one of the most respected in the country. Residents from across the region applied specifically to train under him. Surgical journals published articles on his techniques. The Department of Defense had begun implementing his protocols in 15 military hospitals. But Thomas didn't focus on the accolades. He focused on the work. On a cold morning in late January, he stood in the simulation lab with 15 residents gathered around a training mannequin. This was the final evaluation for the first class to complete his program. Sharma stood beside him, clipboard in hand. "This scenario is based on a real case from Fallujah," Thomas said. "Multiple casualties, limited resources. You'll be assessed on triage, decision-making, and technical execution." He nodded to Sharma. She activated the simulation. Alarms sounded. Lights dimmed to simulate field conditions. 4 mannequins lit up, each displaying different injuries on their monitors. The residents moved immediately. Henderson took charge of triage, directing team members to each patient. Gwyn began chest compressions on the most critical case. Another resident started an IV line. Thomas watched in silence, his eyes tracking every movement. They worked for 20 minutes. Controlled chaos, voices calling out vitals, hands moving with purpose. When the simulation ended, all 4 patients had been stabilized. Thomas stepped forward. Time, 18 minutes, 32 seconds. All patients survived. "Well done." The residents exhaled collectively, some smiling, others collapsing against the walls in relief. Henderson approached Thomas. "How'd we do compared to other teams?" Thomas glanced at Sharma. "You're the fastest group we've trained. And the most efficient." Anderson's face broke into a genuine smile. Thank you, Dr. Reeves, for everything. Thomas nodded. You did the work. I just pointed you in the right direction. After the residents left, Sharma turned to Thomas. They're ready. They are. So what's next? Thomas looked at the simulation equipment, then at her. Next, we expand. General Bradley wants us to train senior surgeons at Walter Reed, then possibly international programs. Sharma's eyes widened. International? The European Union reached out. They want to implement similar protocols in their trauma centers. Sharma set down her clipboard. Thomas, do you realize what you've built here? This isn't just a program. It's a movement. Thomas was quiet for a moment. It's what they would have wanted, he said, his voice soft. My team in Kandahar. They believed in teaching, sharing knowledge. This is their legacy, not mine. Sharma touched his arm gently. It's both. 3 weeks later, Thomas received a letter. It was from Marcus Chen, the construction worker he'd saved during his first week as a volunteer. The man whose vena cava injury everyone else had missed. Thomas opened it in his office. Inside was a photo. Marcus stood with his wife and 3 young children, all of them smiling. On the back, a handwritten note. Dr. Reeves, I wanted you to see what you saved. Not just me, but all of us. My youngest daughter was born 4 months after the accident. I named her Grace. Because that's what you gave me. A second chance. Thank you for not giving up. Marcus. Thomas stared at the photo for a long time. Then he placed it on his desk, next to the photo of his fallen team. 2 lives, 2 moments, connected across time. That afternoon, General Bradley arrived for a scheduled meeting. He'd been visiting regularly, working with Thomas on the National Implementation Plan. They sat in Thomas's office, reviewing training schedules. We've got commitments from 23 hospitals so far, Bradley said. Military and civilian. Your protocols will be standard practice within a year. Thomas nodded. Good. Bradley leaned back. You know, when I woke up after that helicopter crash and saw your face, I thought I was dreaming. Aiming. Or dead. Thomas smiled slightly. You've always been dramatic, General. Bradley laughed. You saved my life twice, Doc. Mogadishu and here. I owe you everything. Thomas shook his head. You don't owe me anything. You've given these protocols a platform. That's payment enough. Bradley studied him. You've changed, Doc. You seem lighter. Thomas glanced at the photos on his desk. Marcus's family, his fallen team. I stopped carrying weight that wasn't mine to carry. Bradley nodded. I'm glad. He stood to leave, then paused at the door. One more thing. The Army wants to award you the Distinguished Service Medal for your work in Mogadishu, Fallujah, and Kandahar. It's long overdue. Thomas's jaw tightened. I don't need a medal. I know, but the soldiers you saved do. They want to honor you. Thomas was silent for a moment. Then he nodded. All right. The ceremony's in 2 months, at Arlington. After Bradley left, Thomas sat alone, staring at nothing. He'd spent so long running from his past. Now he was learning to accept it. The following week, Thomas began teaching his second class. 20 new residents, fresh faces, eager minds. He stood in front of them, just as he had before. I'm not good at speeches, he began, and several residents smiled, having heard about his reputation. But I'll tell you this. Trauma surgery isn't about being a hero. It's about being present, being competent, and refusing to quit when quitting would be easier. He clicked to the first slide. A field hospital. His field hospital. This is where I learned. And this is what I'm going to teach you. The residents leaned forward. Thomas continued. Some of you will go on to military service. Some will stay civilian. But all of you will face moments where everything you know is tested, where protocols fail and instinct is all you have left. He paused. Those are the moments that define you, not the easy saves, the impossible ones. Sharma, sitting in the front row as his co-instructor now, nodded. Thomas clicked to the next slide. And the teaching continued. 2 months later, Thomas stood at Arlington National Cemetery in his dress uniform, a uniform he hadn't worn in years. General Bradley pinned the Distinguished Service Medal to his chest while a crowd of soldiers, many of whom he'd saved, stood at attention. The citation was read aloud. For extraordinary service in combat zones spanning 3 decades. For saving the lives of over 800 military personnel and civilians, under the most extreme conditions, for refusing to abandon those in need, regardless of personal risk. Thomas stood rigid, his face impassive, but his eyes were wet. After the ceremony, soldiers approached him, men and women whose lives he'd saved. Some he remembered, others he didn't. They shook his hand, thanked him, showed him photos of their families. One young woman, now a captain, hugged him tightly. "You saved me in Kandahar, Dr. Reeds, 3 days before the hospital was attacked. I was bleeding out from shrapnel, and you refused to let me go." Thomas remembered her, barely 19 at the time, scared, dying. "I'm glad you made it," he said quietly. "I have 2 kids now," she said, smiling through tears. "Because of you." Thomas nodded, unable to speak. When he returned to St. Catherine's the next day, he found his office filled with flowers and cards from patients, residents, and staff. On his desk was a handwritten note from Cross. "You told me once that you weren't a hero. You were wrong. Thank you for proving it. Julian." Thomas sat down, overwhelmed. Sharma knocked on the door. "You okay?" Thomas looked up. "I think so." She smiled. "Good, because we have 15 new applicants for the next training cycle. Apparently, everyone wants to learn from the ghost of Mogadishu now." Thomas groaned. "I hate that name." "Too bad. It's sticking." She set a folder on his desk. "Also, the WHO reached out. They want to adapt your protocols for disaster relief in developing countries." Thomas opened the folder, scanning the documents. "That's ambitious. So are you." Thomas looked at her. "We'll need a bigger team." Sharma grinned. "Already on it." That evening, Thomas stood in the trauma bay, watching the organized chaos of a Friday night shift. Residents he'd trained moved with confidence. Patients were stabilized quickly. The system worked. He thought about the journey that had brought him here. The pain, the loss, the guilt he'd carried for so long. And he thought about what came next. More teaching, more lives saved, more residents trained. It wasn't redemption. It was purpose. An ambulance pulled up outside, sirens wailing. The doors burst open. Incoming, multi-vehicle collision. 3 critical. The team mobilized instantly. Thomas stepped forward, his hands steady, his mind clear. Sharma appeared at his side. "Ready?" she asked. Thomas nodded. "Always." They moved together into the trauma bay. The monitors beeped. The voices called out. The work continued. And Thomas Reeves, the ghost of Mogadishu, the legend who'd saved hundreds, was exactly where he was meant to be. Not hiding, not running, just doing what he'd always done. Saving lives, one patient at a time. The ambulance doors closed behind him. And the story continued.